Good afternoon and welcome to Private Water Network's Ask the Expert session on radionuclides and private water systems. My name is Nicole Dutra and I'm a Senior Project Coordinator for the National Environmental Health Association, and I'm also the Administrator for the Private Water Network. I will be your moderator today. Allow me to quickly review the agenda for today's seminar. To begin, I will review some housekeeping guidance, then introduce our expert for today's session, then we'll jump right into the Q&A. This session is 45 minutes. So at a couple minutes till, I will bring the Q&A to a close and share some last announcements with all of you. This session is being recorded and will be uploaded to NEHA's YouTube Private Water Network playlist. We'll drop the link for all of you in the chat in just a moment. Questions submitted through the session registration today will be priority. I want to thank all of you who submitted questions for today's session. If time permits, we will address the questions submitted in Q&A option today, but please feel free to comment and engage in the chat option. Share where you're joining us from today. At the end of the seminar, all of you will receive a link to conduct an evaluation survey, and your feedback is very valued, so please do that for us today. So our expert today is Kennedy Holt. As an environmental toxicologist for the North Carolina Department of Health and Human Services, Mr. Holt is responsible for responding to chemical incidents, determining potential health impacts and related exposures to contaminants, and communicating those health risks to communities across the state. During his career with DHHS, Mr. Holt has provided public health guidance to multiple communities impacted by environmental contamination, which includes those impacted by coal ash, PFAS, and radionuclides. During the responses to these events, Mr. Holt worked extensively to communicate the health risks, not only to local health departments and other stakeholders, but to have conversations and work directly with community members to address their concerns. Furthermore, Mr. Holt routinely works with private well owners to help them better understand how contaminants in their wells may impact well owners and their families' health, but also provide recommendations on mitigation and treatment techniques to address those concerns. To this end, Mr. Holt has led the efforts to develop North Carolina's first publicly available electronic tool for providing public health guidance for private well water analysis via the Be Well Informed platform. So, Mr. Holt, I will go ahead and stop sharing and we will begin.
Yeah. All right, thank you for that introduction, Nicole. I'm going to switch ahead and go ahead and share my screen and pull things up. So just be ready for, because you had to read the questions, right, Nicole?
Yes.
Okay, so I'll pull mine up and we'll be
Great.
ready to go.
Awesome. Well, I wanted to kick off today's Q&A session by asking you if you could provide a quick overview of what a radionuclide is and which ones have been identified as contaminants of private water systems.
Yeah, so so just generally speaking, a radionuclide is an atom that has excess energy emanating from its nucleus. And so basically atoms are trying to become stable. And so in order to become stable, they are releasing that energy in the form of radiation. So a radionuclide is different from radiation because radionuclide is an actual atom. So think uranium, radium, radon. Whereas radiation is that energy that's emitted, which there are several different forms of radiation. The ones we're primarily be talking about today are alpha and beta, but there's other radiations such as gamma and such that exist as well. But just for purpose of context, radionuclide is the atom or element, whereas radiation is the energy releasing from that element.
Great. Thank you for that explanation. All right, and then I will begin with some questions that came from those of you who have registered to attend today. Um, so Zach Martin in Minnesota and Thomas Eckhoff in Pennsylvania, you had very similar questions. So I'll go ahead with, are certain regions of the country more susceptible to radionuclides than others?
Yeah, so I kind of jumped the gun there and hit the button. But yes, so there are areas of the country that are more susceptible to radionuclides than others. What I pulled up here are maps specifically looking at uranium um, in the soils and groundwater across the country. So as you can see here, I pulled two different maps because they kind of give two different answers, and I think it just I wanted to illustrate that basically we don't have as much information in some regions of the country as others. Just kind of highlight some of this here. But as you can see on the left map, which is looking at groundwater data here and micrograms per liter for uranium concentration. So we can see that in the western regions of the U.S. is where we see a lot of elevated levels of uranium in groundwater. Um, and in the eastern side, you don't see as much of a continuous measurements as you do in the western end, but you do see some areas up in the northeast, up in the upper Midwest, in the Great Lakes region, and down in the kind of the Mid-Atlantic region in North Carolina, South Carolina, is where we see some of these elevated uranium concentrations in groundwater as well. The map on the right is looking at uranium in soil, which is not always a 100% indicator of where you're to find radon in groundwater, but just to kind of show that there are areas that we know that there's elevated uranium in the soils, but we don't necessarily have the corresponding groundwater data. So if you look here in kind of the Kentucky, Tennessee, Georgia, Alabama region, kind of in that southeast section, if you look at the groundwater data, we don't really have that much there. Whereas if we look at the soil data, we can see that there are elevated radionuclides in that area. And same for like Ohio, kind of has a similar issue there where we don't really have the groundwater data, but we have the soil data showing that. So this is just to kind of illustrate that there are regions of the country where we do have these elevated radionuclides, kind of more so than others.
Thank you for that. Our next question came from Laura Foss in Ohio. How do radionuclides get into drinking water?
Yeah, so radionuclides, I'll say, in my experience, the most common form is they're part of the natural geology that is present in a lot of regions. So in North Carolina, places that we have radionuclides at more elevated levels are associated with areas of geological formations that are known to have elevated levels of radionuclides. And so that's where we see them most commonly. There are other sources that can from mining operations, runoff and such, but that at least in North Carolina, that is not where we see a bulk of it. It's just mainly naturally occurring radionuclides where we see a lot of our concentrations in our groundwater systems.
Right. Thank you. Our next question, actually, we got a couple that were similar from Allison Toller in Wyoming and Katrina Alsum in Colorado. How can you test radionuclides level in water?
Yeah, so there are EPA approved methods for radionuclides. These methods are developed. There are MCL, so that's maximum contaminant levels for radionuclides. Those are the regulations that primarily serve public water supplies, but those standards and methods are used similarly for testing for radionuclides in private wells and groundwater. And I have the links and those methods here. I've also provided on the right-hand side, this is an excerpt, we have a radionuclide and private well fact sheet that we developed in North Carolina. And so we've pulled out the labs that our state lab for public health has certified for doing radionuclide measurements. And so we pulled those out here. So if somebody was to look at our fact sheet, they could reach out to these labs and request a radionuclide sample um, to be taken from your well, and they may ask questions in terms of which specific radionuclides they're looking to test for. But at least these labs can serve as a starting point for people to reach out and get their well tested.
Wow. Kennedy, I'd really like you to share that with me so that I could share it with everyone that's here today in
Yeah.
my follow-up with them. That would
Yes, I can do
be
that.
great. Awesome. All right, our next question, similar questions came in again from Aaron Huget in Illinois and Katie Della Tarza in New Jersey. Is there a proper technique for sampling radionuclides? What type of analysis is done?
Yeah, so as I kind of showed here, there are EPA approved methods. I just kind of pulled out I'll say the more common ones that I've seen done with analysis. There are a litany of other approved methods, and depending on the method, the collection technique and the holding time and all those fun analytical and sample collection parameters can vary a little bit between samples. So I don't want to dive too far into weeds there, but if you were to go to these methods and review them, they do pretty clearly state what you have to do. At least for these methods here, it's a pretty standard glass vial collection. Nothing, no special preservative, really anything in it. The only one being radon, just because that's a gas. So there's a little bit more. I think there's one extra step in there, but otherwise, there's no exorbitant measures needed to be taken to collect these samples.
Great, thank you. Our next question was from Leila Allen in Wisconsin. How frequently should water be tested? Does seasonality play a factor in concentration? What remediation strategies are available and how efficient are they?
Yeah, so I'll just go ahead and say the second part of that question. I think there was some other questions asking later about treatment, so I'll address that later. So I'm not ignoring that part right now. But as far as the testing and seasonality, our standard recommendation in North Carolina is to have your inorganics tested, and which would include the radionuclides and metals every other year. Is our standard recommendation there. I personally have not seen seasonality associated with it in North Carolina. A lot of our regions that deal with more radionuclides in their groundwater are typically areas that have deeper wells that are not as subject to the seasonal variations like it would be for shallower wells. And so I have not seen that, or I have not, and also in the literature, I've not seen any clear correlation between seasonality and differences in radionuclide measurements.
Okay. So then how frequent should people be testing their water for radionuclides and what remediation strategies are there out there?
Yeah, so as far as testing, we recommend every other year is what we would recommend for testing for that as far as a typical cadence. As far as remediation strategies, it depends on the radionuclide that's there, what you're measuring, but things such as reverse osmosis, ion exchange systems, aeration, activated carbon. All those are potential options. It just depends on which specific radionuclide you're looking to remove. And like I said, later I think I get more into kind of parsing out which one's more effective and which, and kind of the efficiency as well. So stay tuned for that. For that.
Okay, sounds good. Um, then from Eric Yegi in Illinois, are there any reliable home test kits for radionuclides?
So for I'll say I don't know is probably the best way I can say that. There are I guess labs or sample kits that you can order that can test for radionuclides. I do not have a great understanding of how reliable they are or how accurate they are. When I have looked into them, I've seen prices ranging from close to 100 to low 200s. and I know in kind of in that range is kind of sometimes what I've seen some private labs charging as well. Um, and so I typically, if that people can, I recommend they go through a lab that has been certified just so they know that the results they're getting are accurate, and kind of have that backing of going through QA QC most of the time and all that. The only difference I would say is this: for radon, there are pretty extensively and pretty well documented kits for testing indoor radon in your air. And a lot of those can serve as kind of your, um, I'll call it canary in the coal mine, to kind of indicate whether or not you may have an issue or not, and if further testing needs to be done. But as far as for groundwater and private wells, I don't know. I have not seen anything that would cause me to, um, in quote unquote, like recommend one for anybody.
Okay, sounds good. All right, from Julia Lee in Colorado, is ingestion or inhalation the primary health risk with radionuclides?
Yeah, so for a majority of the radionuclides that we can test for, we are primarily concerned with ingestion. So with uranium, radium, the alpha, gross beta is what you'll typically see it reported on it in a test. We're really looking at ingestion as the primary route of exposure to be concerned about. As you can see here, this image that's showing here is for alpha radiation. It really doesn't go past the skin. And for beta radiation, it doesn't really go through clothing. And so dermal exposure is really not a concern with a lot of these. It's not the primary concern we have. It's that ingestion concern. I would say for radon, inhalation is the more worrying route of exposure that we have for radon. There is an ingestion component of radon as well. However, the health risk associated with inhalation of radon is typically higher than through ingestion. But again, testing and what specific exposures you're having would kind of tell you more about your specific risk.
Okay, thank you for that. We received a few questions that were very similar from Sherry Storian in Iowa, Emily Van Brent in Michigan, and Jennifer Church in Wisconsin. How serious of a problem is radon in drinking water?
Yeah, so I'll say radon can be a pretty significant, pretty serious risk in drinking water. Just for rough approximation, 10,000 picocuries per liter of radon in drinking water is roughly equivalent to 1 picocurie per liter of radon in air. And for awareness, the EPA has thresholds at 2 picocuries per liter of radon in air, where they recommend potentially considering options for mitigation reduction, and then at 4 picocuries per liter in air. The EPA's recommendations are to seek out mitigation and get those levels below 4. So just kind of using that rough approximation, you can kind of do some rough calculations there. But like I said earlier, radon itself, there is an ingestion component that can be cause for concern as well. Again, that's typically at higher levels of radon in water. It's really hard to say without doing specific testing to know whether or not radon in your drinking water is your primary exposure level there. But it'd be something that definitely testing for radon in drinking water is not unwarranted, is I guess the best way I can put that.
Right, thank you. Next question came in very similar across several of you. So I'm just going to go ahead and ask the question, what's the best filtration or treatment method?
So I will this will kind of get in here, as I mentioned earlier with removing radionuclides. It really depends on which radionuclide you are trying to remove here. Um, so as I said earlier, ion exchange can be useful. And again, it depends on whether you're targeting uranium or radium, whether it has to be a cation exchange system or an anion exchange system that is to be more effective. Um, there, you also have reverse osmosis, which can remove a lot of the radionuclides here as well. And then radon is more, I would say, the outlier here because, as I said earlier, radon is a gas, even while it's in water. And so when you're looking at removing radon, you're looking at a couple different options. I would say the most common one is this aeration system that's mentioned here, which is basically I'm the grossly oversimplified, and again, I'm not a treatment specialist, so I apologize if somebody is and I'm butchering this, but it's basically a system that basically fans and mixes up the water to knock the radon out of the water and into the air, and then it vents outside. Activated carbon and this surface and decay storage are also viable treatment options. Just like I said, the aeration systems is what I more typically see. For radionuclides. And just time to go along with these different systems here. This was taken from document and presentation from EPA, but showing the efficacy of removal for these different systems, and for radium and uranium, showing that RO is so reverse osmosis. Sorry, I say acronyms way too much. That's a bad habit. Reverse osmosis is typically a more effective, or can be the most effective, but other systems as well, such as the ion exchange systems, and different softenings can also be effective. It really is just to be something I would recommend anybody that's looking to get a system to remove any of these is to work with local treatment specialists, to kind of help understand what could be the best system for your particular water. Because one of the things I would say these don't account for is the presence of other contaminants in water. So I'll just say iron as an example. Iron can also be removed through some of these water softening technologies and ion exchange, and can also impact the efficacy of RO systems. And so it's something you kind of want to have a more holistic picture, when you're selecting a treatment system, just so you're not potentially fixing one problem, but creating another. So I know that was a very long answer, and if anybody has any further questions, you can reach me afterwards. And I can probably talk somebody's ear off on this, but I don't want to steer us too far off course.
Thanks, Kennedy. Um, Another question had come in from Brandy Hamilton, Missouri. How can homeowners know if a treatment system is appropriate? And there are no POE GAC systems with NSF ANSI ratings, for example?
Yeah, I will say that it is difficult. I will say, as far as knowing what would be efficient, there's two options I typically recommend people to go through when trying to figure out this information. One is, if somebody's considering a system for that, is reach out to the manufacturer of that system. And this is my personal experience, I'm speaking from here. Most manufacturers, if you're asking about how effective their system is or can it remove something, they will be able to tell you whether it does or doesn't, and should be able to provide that data. And if they can't or won't, go search elsewhere. There's other businesses out there. And the second piece would be is, at least in North Carolina, because of our, I guess, different geological formations and kind of some, I'll say, um, specific conditions in some areas of the state, there are local experts, such as, I'll say, plumbers or treatment specialists that know some areas better than others and what contaminants are there and what systems can be effective at removing those. I know that is sometimes harder in some areas to get, but I oftentimes ask people to go to those resources because for myself, work at the state level, and it's hard for me to know every single condition across North Carolina and all the different businesses and stakeholders in the area. And so a lot of times I do ask people to kind of look more locally and try to point them in terms of different resources locally that they should ask for and try to guide them that way just because I can't at least across all of North Carolina, I can't be the perfect resource, unfortunately. But those would be my two best recommendations for folks.
All right, great, thank you. Another question for you from Sharon Nakama in Rhode Island, Andrew Lazar in Maryland, and Keon McIntosh in Colorado. Their questions were very similar, so I'm especially interested in treatment guidance, especially for carbon systems, which, if not maintained, can be a hazard.
Yeah, so again, I'm not um, a treatment specialist, so I apologize. I probably won't have the most detailed answer. But with carbon systems, oftentimes they are calibrated for specific conditions in terms of removing and trying to not overload the systems, not cause backwashing or breakthrough issues as well. And so when it comes to carbon systems, whoever installs it and calibrates it should be able to provide a maintenance routine or cadence where basically after so many gallons of use or so much time has passed, exchanging the resin or the GAC or washing it is recommended so that you're not creating those breakthrough scenarios where you're basically introducing a bolus of any of these contaminants into the drinking water supply. Um, would be my best guidance on that. And again, I apologize not being the treatment expert here, but that would be the how I would guide somebody through that process is just make sure you're working and asking those questions of any contractor that you're doing it, or I guess you can buy these systems yourself and do it yourself if your plumbing skills, if you're confident in your plumbing skills. And if that's the case, definitely follow manufacturer guidelines. A lot of them do have guidelines or ones that you can call and request in terms of what is the appropriate kind of, like I said, schedule to operate that system on.
Great, thank you. Our next question came from Christine Foley in Vermont. If elevated gross alpha is not due to radium or uranium, do you advise further testing or to just install a RO system? Is there any way to mitigate gross alpha in the shower without installing a POET?
Yeah. So with the so I'll address the first part with the testing for gross alpha and gross beta and testing. I would say outside of the gross alpha and gross beta test, uranium, radium, and radon, those are specifically tested for because those are I would say, the more common and ones, and especially with the health risks associated them that we have good information on and can kind of provide more detailed guidance on. I show these two slides here showing that outside of those measurements, at kind of like outside of the five we're talking about here with the radon, radium, uranium, gross radium, gross alpha, if you're trying to find anything outside those parameters, I would say you're almost looking for a needle in a haystack, just because of the what could be there. And I don't know the geological conditions for everywhere. Everywhere is going to be pretty different, and I would imagine. Um, but testing outside of those, I just don't know if you're to one find anything or really how to interpret that number. I mean, as you can see here on the right side, there is some, I would say, guidance in terms of if you were to look for any of those specific isotopes, those elements, you could kind of do rough conversion to the 4 milligram per year dose that the gross beta number is based off of. But again, I would say outside of those five parameters, information is pretty sparse, and so I just don't know how helpful it would be. As far as doing the reducing gross alpha at a shower, outside of using a point of entry treatment system, it would depend on if you're able to identify the main culprit of that gross alpha radiation. Like if you're able to see that it's uranium or something like that, you could potentially go a whole house route. Otherwise, um, I don't have great a great piece of guidance on that for reducing it. I will say, kind of as I showed earlier, the gross alpha really isn't penetrating the skin. It's not really a dermal exposure. Gross alpha is usually coming from radiation from metals in the water, so they're pretty heavy, so they're not aerosolized, so to speak. Like they really are kind of falling out with the water as it's kind of going down the drain. And so I know you can get, especially with kids can drink bath water. I have little kids, and it's a challenge to get them not to drink the bath water. So I know that can be a concern, but really, um, showering, at least for things that aren't radon. Radon is its own special thing because it kind of comes out of water. It's volatile, but for other radionuclides, it's really not much of the exposure risk is pretty low in those bathing scenarios. Um, Again, sorry, that might have been a long-winded answer, but I hope that addressed
No,
it.
that was great. Thank you. Our next question came from Michael Troutman in Washington. What are the most economical and effective methods for removal of radionuclides from water sources? Is there a risk of cross-contamination of aquifers in some wells?
Gotcha. As far as most economical, if we're talking about a private well, I know I sound probably like a broken record, and I apologize. It really depends. It really the testing really is to tell you the most information, be able to kind of help understand what you're looking at, what you need to address. As far as I guess expense, I'll maybe it's kind of dipping a little bit into my personal professional views on this, but um, expense, at least in North Carolina, private wells are private property, and people can make their own decisions about their private wells and their exposures to their family, themselves, and such. And so, I mean, you can kind of point to people like I would say typically a single point of use RO system is typically to be cheaper than a whole house point of entry system. But in terms of I guess saying whether one is more appropriate for one well owner or not is not really, that's kind of dipping into their own what they value in terms of their health risk and exposures. And so it's hard to really say that from as a general, just kind of generally speaking. But again, just kind of on a I'll say a very rough scale, if you're looking at a RO system, like a point of view system, anywhere from 500 to 1500 is what I've seen, depending on the bells and whistles you get with it. For a point of entry system, like one of those ion exchange systems I've mentioned, I've seen them range anywhere from 1,000 to a few thousand on those. And those aeration systems, like I mentioned for radon, those are definitely a couple thousand to a few thousand as well. So again, it really just depends on what is there and really what what the well owner themselves, what they value, what their priorities are. And so that's kind of the best way I can answer that.
Okay. Is there risk of cross-contamination of aquifers?
Um, so I guess I don't understand exactly that question as far as like if there's like a well and then a neighboring well. I mean, not all the times are they drawing from the same aquifer, same water table. I haven't heard of any cross contamination on that end. I'll say one of the things I've heard concerns about, and maybe no, I'll kind of jumping ahead here is I've heard concerns about is kind of the residuals, the leftovers from these systems. So, like when you do the backwash to recharge the system, or you're getting rid of the RO filter, what about those, I guess, waste products from these treatments? Is like, are they considered hazardous materials? What do we do with them? Or is that backwash that goes into your septic or yard, is that contaminating the water? And unfortunately, I don't know the answer to that. I will say we have looked into that here in North Carolina without much resolution on that end. Um, I will say we don't treat them as hazardous waste for people. Like people aren't now handling hazardous waste and now responsible for that burden in North Carolina. We're not trying to impose a burden on something that they are trying to address and it wasn't really their fault to begin with anyways. Like they don't control the geology under their property. But as far as how it impacts the neighboring properties, aquifers, groundwater, I don't have a great answer on that one.
Okay. All right, thank you. From Ifeani in uh was asking what steps can be taken to safely manage and mitigate radionuclide contamination in wells over time.
Yeah, so as far as mitigating it over time, I mean, kind of just kind of going back over what tested is like one is testing. I think testing your well water is the most important thing because that really tells you what's there and what you need to be addressing. If you're not testing your water, you're just kind of taking a shot in the dark. And who knows, maybe there was nothing to worry about to begin with. That would be the best scenario. But really, if you want it to do it appropriately and make sure you're addressing the correct thing, you need to test your water. And then once you have results that indicate a potential issue with radionuclides, the best steps at that point is really, I'll kind of go back here real quick. This kind of using this as a kind of a starting point, kind of look at what treatment systems could be appropriate for reducing those radionuclides. And if it's something that maybe not concerned, maybe it's just uranium you're dealing with, so you're not really concerned about bathing, showering, things like that. You're really just concerned about drinking and cooking with the water. Then you could potentially look at point of use reverse osmosis system at your kitchen sink, and that's eliminating 99% of your exposure. And so, in terms of bang for buck, in terms of mitigation, you can do that. You could go the whole house route if you just want to kind of, I just call it forget about it kind of going forward, like where you set it up, you don't have to worry about what faucet you're at, you just have to kind of follow your maintenance schedule, and if it's working then it's kind of outside out of mind at that point. But that would be kind of that. And then once you have your testing and your treatment system in place, it's making sure you adhere to that schedule so that you're not letting the system get overloaded. Make sure you're testing just to make sure that you're still addressing the correct issues and nothing's changing. But if you do all those steps, that would be the best way to help mitigate any exposure coming from your well.
Okay. All right, from Paul Better in Colorado, what is the more relevant analysis to assess water consumption risk, specifically nuclide concentration or total alpha emissions?
So as far, I would say it's kind of a holistic picture, and I would say it's something that knowing what's in your particular areas to be more helpful. Um, and the reason I say that, and I'm not trying to pick on anybody here, but I saw a colleague from North Carolina in the chat earlier when they popped in. And where they work, they have some of the residents have issues with radionuclides, and they know from testing and working in the area specific radionuclides to test for that are more common that can help kind of uh, without having to do a whole suite and a whole investigation, can kind of more rapidly identify whether or not there's a potential issue there. So they've, through their extensive work in their region, they have really help better guide their particular constituents to do the more appropriate steps to kind of help them save money, help kind of move the process along and address the issues as appropriate for their region instead of having to do the whole kit and caboodle. So it would be something that if you're interested for your particular area to kind of understand this issue, if you're just getting started, it may be something that you need to kind of do everything, so to speak, to start off with, looking at uranium, radium, radon, gross alpha, gross beta, to kind of understand what is the exact issue in your area. But once you have that data and maybe you have sufficient enough sample where you're confident this is the issue we're primarily dealing with here, then you can start kind of tailoring that panel more for your area to be able to kind of cut down some of the cost and help better kind of provide more pointed and focused health guidance and mitigation strategies for those folks there. But again, just like I said earlier, a lot of these radionuclides are more associated with naturally occurring contaminants, or not natural, or naturally occurring from geological formations. And since those vary across our country, it's very hard to say that generally for everybody.
Understandable. All right. Let's see. From Jasmine Park, in Colorado, do tailings pose a risk to drinking water?
Um, so I assume that's talking about mine tailings is where when I saw that question, I assumed that's where it went. And that being the case is yes, mine tailings can impact groundwater. They can impact wells. I will say in terms of radionuclides, their exact impacts. I do not know enough about various mining operations and the presence of radionuclides in those different mining operations to say anything more than generally that tailings can impact groundwater. And if there are private wells in and around mines that have tailings or there's runoff from those mines, then that is something to at least be aware of and hopefully be able to provide testing or monitoring guidance to those private well owners just to make sure they're not being impacted.
All right. We have a couple minutes left. I'm going to take this next question. What are your best tips for communicating with the public about radionuclides?
Yeah, so this is something I've kind of taken, like this is an excerpt, and I know the labs that I had listed up there earlier was excerpts, but I would say the best way to communicate with folks is one, um, help explain what radionuclides are and why they should be a concern. One of the at least in my experience, one of the big misconceptions is that radionuclides are coming from some type of man-made contamination. I guess it's not something we typically think about in terms of our groundwater having naturally occurring radionuclides or this radiation in it. So really helping people understand that this is not necessarily a pollution problem or contamination problem, but it's something that could be just naturally occurring from the geology in the region kind of helps people understand that and understand that it could be potentially impacting them. And then kind of helping make sure that they understand that there are steps they can take to address it. So it's not just something where we're going looking for a problem and saying, all right, well, we found this, there's nothing you can do, have a great day. It's this we are recommending that you look for these things and test for these things, because we think they could be an issue in this area, or we know they could be an issue in this area. And if you do find them, here are steps that can be take to help mitigate your health risk. And so kind of making sure that people understand that this isn't a fishing expedition. Like this is something that we know can impact people, and that we do have guidance information to help people kind of navigate and mitigate those risks is really goes a long way to help kind of people understand that this is kind of a public health initiative, and that basically public health professionals we're trying to look out for folks and eliminate any exposures they may have.
Yep, great. Well, we have come to the end of our 45-minute session. I'd like to thank Mr. Holt for sharing his knowledge and expertise on the topic today. So thank you. And thank you all for joining us today. Please do take a moment to complete the evaluation survey that you will receive the link to following the webinar. Thank you, and to everyone, have a wonderful rest of your day. Thank you.